Thank you for joining us for another informative, educational, and entertaining edition of Music and Medicine with Dr. Charles Modlin, kidney transplant surgeon, board-certified urologist, public speaker, and well-known community national leader for the elimination of health disparities, dedicated to informing you, the listening audience, about important health topics and health information that you, your family, and your community need to know, while at the same time providing you with quality entertainment, because music and entertainment is medicine. Dr. Modlin's co-hosts are Jerome Brown and registered nurse Jonathan Branch, and the program often includes special content expert guests. So, without further ado, here is the host of the show, Dr. Charles Modlin.
Hi, my name is Dr. Charles Modlin. I'm here to tell you about our upcoming Minority Men's Health Fair, which is actually open to all men, regardless of race or ethnicity, but we specifically are reaching out to men of color because men of color are the group most commonly afflicted by a number of chronic health conditions. Conditions such as increased rates of high blood pressure, diabetes, heart disease, kidney disease, and a number of cancers. In fact, one example is that Black men develop and die from prostate cancer twice as often as their white male counterparts. All of these healthcare conditions contribute to the fact that men of color have lower life expectancies than the majority population, but there is something that we can do about it, and that's perform preventative health screenings. We encourage all men to attend our free Minority Men's Health Fair, open to all. We're providing a number of screenings, health examinations. We're going to provide you with health information that it's important that you become aware of to improve your health status, your health condition, and your health outcomes. So join us for our Minority Men's Health Fair. Looking forward to seeing you all there. Thank you.
Well, thank you, Mr. William Reed, for that excellent introduction. I really appreciate it. And thank you, Dr. Modlin, for that statement about welcoming all of the men to the Minority Men's Health Fair. So, yeah, we've looked forward to this special edition of Music and Medicine all year long. This is our MetroHealth Minority Men's Health Fair Music and Medicine show where we encourage men. We're trying to inform the community to let the community know that this health fair is happening. So we call it the Minority Men's Health Fair. It's actually open to everyone, regardless of race or ethnicity or even gender. But again, as indicated, we specifically want to reach out and engage men of color because men of color have the highest incidence of a number of the healthcare disparities that I just mentioned in that short introductory segment. I want to go ahead and bring on our co-host, Mr. Jerome Brown. If you're there, Jerome. Hey,
what's going on, Doc?
Oh, hey, man, we're very excited. I know you are. You attended the health fair last year.
Oh man, yes, I did, and I will be there this year as well.
You know, you were the star of the show last year.
I did my part. But this year is even more important than last year. So we encourage all fellas to come on out, man. We need everybody out there.
Yeah. So April the 27th, between the hours of 5 and 8:30 p.m., it's going to be held in three very convenient MetroHealth locations at the MetroHealth main campus, which is on West 25th Street. We're going to be in the outpatient pavilion on the main campus. We're going to be at the Cleveland Heights Medical Center campus. That's at 10 Severance Circle. Many of you know where Home Depot is in Cleveland Heights. It's right next to Home Depot across the street. And we're going to also be this year at the MetroHealth Ohio City MetroHealth campus, which is 4757 Lorraine Avenue. Again, we're trying to make it easy for the gentlemen to attend east side locations, west side locations. Again, it's free. I forgot to mention this is a free health fair, over 30 free screenings, health examinations, health information. We have over 100 community organizations providing social services and information to the attendees. It's free. Most guys will just show up on the day of the event, walk in. The registration takes 5 minutes. if you'd like, you can pre-register by calling 216-957-3862, 216-957-3862. But again, you don't have to pre-register. You can just show up. So Jerome, I don't know if you realize this is our 20th anniversary.
The 20th anniversary.
Yeah.
Wow.
Can you imagine how young I looked back then, 20 years ago?
Oh, you probably was a baby, man.
20
years ago, you had an afro.
Yeah. I'm going to have to find an old picture of that first healthcare flyer. Yeah, 2003. I started this along with several colleagues in the support of the administration over at Cleveland Clinic back in 2003. The first year we had 35 men show up, which I thought was a tremendous turnout at that time. And over the years, as we further, became part of the community, networked with the community and demonstrated to the community that this was in their best interest and that we were there for them, the magnitude, the masses actually responded. So over 18 years doing this at Cleveland Clinic, we served around 25 or 30,000 men. And,
so check out, how many were at the first one?
35.
35 people. 35
men, yes.
And now how many were there last year?
So last year we was the first year at MetroHealth, and we had roughly 1,000 men. We had some women undergoing the screenings. We hope to have even more this year because, the way I look at it, this is a potentially life-saving opportunity. A lot of men mistakenly feel that if they feel well, if they don't have any signs, symptoms, pain, discomfort, there's no reason for them to undergo a preventative health screening, a health check, and that cannot be furthest from the truth. I mean, you can have prostate cancer, colorectal cancer, heart disease, diabetes, kidney disease. You can be susceptible to developing a stroke, peripheral vascular disease. A number of conditions can exist without any signs or symptoms. So the more lives that we can touch, it's all about trying to touch more lives.
Yes.
I always remind everybody that this is not an attempt for MetroHealth to take patients away from their existing physicians, advanced practice providers, healthcare institutions. We're offering all of these free screenings because we do know a number of individuals lack access to quality healthcare, but we encourage even individuals who have existing healthcare providers to attend, because I guarantee you there are a number of examinations and screenings that we're going to offer all in one setting in a 3.5-hour period that it would take probably a couple years to get if you went individually, to different physicians, different specialists. We have almost every specialist, clinical subspecialist, we're screening from head to toe. So, come to the health fair. We're actually going to give you the results. If you have existing doctors, you can take these results back to them and review them. If you don't have a healthcare facility, we welcome you with open arms. But again, this is free. I can tell you every year, again, this is the 20th anniversary. I can't believe it, but every year we find very significant numbers of cases of serious disease states. And
you're going to find it this year as well. You're going to find it this year as well.
We're going to find it this year as well. Mm-hmm.
And that's what's great about the 20th year of doing this type of work, because every year somebody is saved or somebody is helped out. From the 35 to the 1,000 that were served last year, or, a couple thousand last year. Yeah. So, you must continue that, and we must continue that. And this is about fear with men. Men don't want to face those fears of health conditions. So if there's any man, I'll be over there personally, if there's any man that feels a little bit of afraid, just reach out to me, and it'll be in privacy, and I'll get you what you need from over there, and I'll introduce you to certain people that may help you. So if there's any guy out there that has the fear of getting a health screening, just reach out to me, and I'll personally point you in the right direction. We have to get over that and let you know that there's somebody that will be there with you if you are facing that.
And you can't even, that means so much to me, Jerome. I really appreciate you, providing that personalized service, because that's going to make a difference. And I can tell you that we do know a lot of men fear undergoing health screenings. One example I do know is that men are afraid of getting the prostate exam, getting screened for prostate cancer. But one thing that a lot of men don't know is that, it's very rare that we have to do that prostate digital rectal examination. There's a simple blood test now. It's called a PSA, prostate specific antigen, a simple blood test, a painless blood test. I mean, and that can give us a lot of information. It doesn't diagnose prostate cancer, but it tells us as urologists, the likelihood that a given individual will have prostate cancer and might need to have additional diagnostic studies. So, I'm a urologist. Urologists are medical and surgical subspecialists. We treat both men and women, but we also have expertise in men's health issues, including reproductive health, prostate, benign, non-cancerous prostate disease, prostate cancer, diseases of the kidney and urinary tract. So I always say every man needs a urologist in addition to a primary care provider. If you think about it, most women have a OBGYN, right? And they are specialists in women's health. So likewise, we can facilitate and augment the care that you're getting from a primary care physician. We're not here to replace the primary care physician, but we are here to augment the care that they provide you. So, as I said, Jerome, you actually were the star of the show last year, and I'd like to show the audience what I'm referring to. We have a short video clip, if you would allow us to show that. You don't mind, do you, Jerome?
Go ahead. Not at all.
Okay, thank you.
Is your wealth. And by the looks of it, all of these men want to be wealthier, Jerome Brown included.
This is my first one, and I'm going to get my blood pressure checked. I'm going to get my ears checked. I'm going to get my cholesterol checked.
These dozens of men coming out for the annual Minority Men's Health Fair at MetroHealth, screening themselves from head to toe.
Untreated high blood pressure, diabetes can lead to devastating consequences, heart attacks, strokes. So again, it's our responsibility to provide this access and opportunity. We want the men to be empowered.
And many of those conditions that Dr. Charles Modlin just referenced impact men of color disproportionately. The U.S. Department of Health and Human Services finding black men are 30% more likely to die from heart disease and 60% more likely to die from a stroke than non-Hispanic white men.
We want to bring that level of awareness, that education to minority men in order to give them opportunities to take better care of themselves. We really want to focus upstream more so than when somebody comes in and they've got devastating outcomes that sometimes medicine can't correct.
We've been doing this for a number of years, and we know every time we do this health fair, we find a number of serious conditions that the men didn't know they have.
And catching those conditions now will create changes for others down the line.
You're impacting a lot of lives generationally, because if I'm healthier, my kid is healthier. That kid after that is healthier. So this is a snowball effect that we must continue.
In Cleveland, DeLon Dillard, News 5.
Yeah, we can't thank you enough for that. Those comments. That you're right. It's all about a snowball effect, and the healthier that the parents are, it's going to translate to improving the health outcomes of their children and their grandchildren and so forth. So
then all the way down to the DNA, Doc.
Oh, yeah.
All the way down to the smallest of cells, and that's how major this is in the type of work that we're talking about. Just a healthier human being. Period.
Without question. So, as I said, we're going to have every medical subspecialist there. So, we have dermatology to check your skin. A lot of people of color don't realize that people of color can actually get skin cancer, including malignant melanoma, which, if caught earlier enough, can be treated and cured. We're going to be checking your vision. We're going to be checking you for glaucoma. We're going to be doing oral checks, dental checks, head and neck checks to screen for enlarged lymph nodes. We're going to be assessing your pulmonary, your lung capacity functioning. We're going to be taking a history in terms of whether or not you have a a long smoking history, which would qualify you to undergo what we call low dose CT scanning, CAT scanning of the lungs, type of X-ray. We're going to be doing abdominal examinations, peripheral vascular examinations. We have our vascular surgery department doing a carotid duplex examinations to assess whether or not you have narrowing of your carotid arteries, which could be an indicator of a potentially a pending stroke, or it's a risk factor for somebody developing stroke. We're going to be doing mental health assessments, prostate health, prostate and kidney assessments. We have physical therapists, we have orthopedic surgeons, we have spine specialists, we have foot specialists, podiatrists, we have neurologists doing memory assessments. We're taking your blood pressure, your pulse, we're checking your heart rhythm for any arrhythmias. We have bariatric people there checking your BMI, your body mass index. We have endocrinologists, who specialize in diabetes. We're drawing blood for kidney function, PSA, hepatitis, HIV, vitamin D. Vitamin D levels can actually, low levels can actually predispose individuals to heart disease and cancers. I've probably left some things out, so.
I'm sure, but you named an awful lot of stuff too, though,
Yeah. I say we're having every ologist that you can think of at the health fair. And again, it's all free. Imagine if you had to go to your physician or advanced practice provider individually for a lot of these tests. I mean, it would take quite some time, and it would be very expensive also.
Very expensive. And that's another one of the fears, so remember, everyone, this is a free event. Come on out. This is a free event.
Mm-hmm. So I forgot checking your cholesterol also, come to the health fair. It starts at 5. We're going until 8:30. We're going to be starting right at 5. You can get there a little bit earlier if you want to. The registration is very simple. It's simplified. Takes literally no more than 5 minutes. And also we encourage the men to visit all of the exhibitor tables, because there's so much information that is going to be gleaned by visiting these, a lot of the external exhibitors. And again, the success of the health fair is due in large part to the volunteers that volunteer their time. MetroHealth volunteers, they work all day, and then they volunteer their services late into the evening to serve the public who the health fair attendees. Yeah. I'd like to thank our CEO, Dr. Erica Steed. She's our new CEO at Metro. She's, I commend her, and I thank her for allowing us to carry on this tradition. I'd like to thank, Mr. Alan Neville. He's our Senior VP of Equity, Inclusion, Diversity, Community Relations. Margie Diaz, Jaime Garay, LaShawn Carson, Arlene Anderson. I can't even think there's so many people. I can't name everybody. But again, we have about 650 volunteers. I should have written down all of their names. I would have read all their names,
Good luck.
Good. So,
I'll be back tomorrow.
Yeah. But no, again, this health fair takes about literally 8 or 10 months to plan. There are so many moving pieces and parts. I'm grateful to the media. Also, we're working with every TV station. Radio 1, WOVU. I'd like to personally give a shout out to Mr. Jay Williams. He's the general manager over at WOVU Radio. I've been working with him for literally 20 years. But I also want to mention our sponsors. We have the St. Luke's Foundation, Mr. Tim Tramble. We have First Energy Foundation, KeyBank, and also Anthem, who are our major sponsors. So a shout out to them, and we're very grateful for their sponsorship that allows us to, conduct this health fair. And again, we need all of the men to respond, pass the word, spread the word. Tell 10 men and have those 10 men each tell 10 other men. We spend a lot of time also going out to the pastors, United Pastors in Mission. We want to thank them. The Baptist ministers, all the different, clergy out there who have helped, promote the health fair and spread the word. I look at this as a day dedicated to their health ministry. Really, that's how I look at it.
And that's what it is.
Yeah, that's what it is. You know, I think it was Booker T. Washington who said, "Knowledge is power, but only if acted upon." And we do know that over the years, we've been able to reach a lot of men, engage a lot of men, educate them about the importance of preventative health screenings. But they need to, you know, that knowledge is very important. Don't get me wrong. But for it to benefit them and their families, they really need to show up, take advantage of the you know, this opportunity that we're providing. Again, even if you have existing doctors, you know, healthcare institutions, you know, nurses that are helping take care of you, you know, come to the health fair and you know, learn some more about important health information that's going to keep you and your family, your community more healthy. So how else can we
learn
yes.
learn some more about you? You know, you're going to learn about yourself.
Exactly.
And that's the best information in the world right there.
So, you know, Jerome, you mentioned, you know, some men respond to different stimuli than others. I mean, some, you know, we have to, again, we're not trying to scare anybody, but some men are more responsive to, you know, hearing messages of fear. And again, that's not, we're not here to scare anybody, but you know,
no judgments, nothing like that.
Yeah.
You know, no fear. You know, it'll be okay, brothers and sisters. So you just have to get that feeling out of your tummy there, you know, and go ahead and make that commitment. But you have to take the first step. Right. We're there for you the rest of the way, but you personally have to take the first step. And that's the most important part.
Yes. And I'll tell you, you know, some men respond to their significant others, their spouses, their girlfriends, their grandchildren, their children, you know, their parents. I mean, whoever, you know, whoever is out there, if you know a man, especially a man of color, we welcome, again, everybody, but men of color have the highest incidence of all these healthcare disparities. And in fact, these healthcare disparities culminate in about a 4 to 8 year shorter life expectancy in African-American men compared to their Caucasian American male counterparts. 4 to 8 years shorter life expectancy. And that is unacceptable. And we do know that much of that is due to certain social determinants of health. But we do know that one contributing cause to the higher mortality as a result of undiagnosed prostate cancer, colorectal cancer, high blood pressure, heart disease, it's delayed presentation. You know, in the case of prostate cancer in Black men is just as curable as it is in white men. But one of the issues is that Black men, you know, on average present with later stages or higher stage disease. So, and again, the other thing is not all Black men know, or not even all healthcare providers actually know, that when it comes to screening for prostate cancer, when you should start screening varies according to your race. And, you know, we don't know what the complete definition of race is. It's a social construct. We understand that. But Black men should start screening at age 40 years old, whereas their white male counterparts don't have to start until they're about 55 years old, unless they have a strong family history of prostate cancer themselves. That's a 15-year earlier time point when Black men need to start, again, because of the higher, the twice the incidence and twice the death rate. Correct. So there are also some differential recommendations in terms of screening for lung cancer, you know, in African Americans, screening for liver cancer. There are different medications that are more effective in treating high blood pressure in Blacks versus whites. There are a lot of nuances in terms of screening and treatment of certain disease states based on the race of the individual. And of course, we have to be responsible and when we're not trying to stereotype every single person, but we're at MetroHealth, we understand that there are differences in metabolism of certain medications, differential response rates, differential screening recommendations, and that's what the health fair is all about. You know, you come to the health fair, we're going to respect you, we're going to listen to you, and you know, we're here for you, and our mantra, and this is not just a mantra, it's not just a saying. We're doing the health fair because you matter. And Jerome, we've talked about this before. A lot of men of color, black men in particular, have a sense of helplessness and hopelessness and feel that nobody cares what happens to them. So why should they go, get a health screening? Well, we care. You care, Jerome.
And that's the furthest thing from the truth.
Right.
The furthest thing from the truth. Once you understand how important you are to those around you, including me and you, Doc, those men that are out there that have that fear are just as important to us too, because they contribute to the whole system altogether. So if they can add something positive to what we're doing, it's a beautiful thing. And the healthier that man is, the better he can do for overall, so it's everything's important. Yes.
So I'd like to thank Russell Johnson, who's behind the scenes, our producer. He's on the screen, and you can see our website, www.metrohealth.org/MMHF. MMHF stands for Minority Men's Health Fair. 216-957-3862. Phone call to register. So anything else to say to encourage the men, Jerome?
Oh, April 27th, fellas. Come on out, take that first step, and then we'll help you take the second, third, fourth, and fifth steps. But we need you to take the first one. So if you have a little bit of fear in your heart, you can personally reach out to me, and I'll walk right with you. There's no problem, brothers and sisters. And we welcome all, not just minorities. We welcome all men to come and get your health screenings and just have a nice time with everybody out there and meet a lot of great people. That's for sure.
Absolutely. And so thank you for being with us this evening. And I look forward to seeing you on the 27th, Jerome, and everybody out in the listening audience. We're going to close out the program by hearing the wonderful music of Mr. Ken LeGrand. He's been on the show before, but he's a remarkable saxophone player. He's also a teacher at the Shaker Heights High School. So thank you for joining us, and we'll see you on Thursday, April the 27th, 5 to 8:30 p.m. at the Minority Men's Health Fair. Thank you.
Let's go.
April 27th, man. You matter. You matter. April 27th.
Wow. April 27th. Let's go.
You matter.
You matter.
You matter. Okay, we'll see you guys later.